He seemed like himself. He was happy-go-lucky. He was kind of getting back on track, and we just thought we had it in the bag, you know. And my son Jordan died by suicide August 19th, 2015. When I first started it, I just wanted to save at least one family from going through what we went through. Last year, our first year, we raised over $32,000, and we had 571 walkers in a town with a population of 1,009.
First, you have to reduce the stigma of the professionals. You have to reduce the stigma in the schools. You have to reduce the old way of thinking of just pull yourself up by your bootstraps. When we started, we didn't have any money. We were just people sitting around a table with ideas. It's an organization that targets a problem and tries to hit it head on, whether it's easy or difficult. We say there's a stigma problem, right? And so how can we address that? That was our first thing. There's a resource problem. What can we do about that? Let's create a clearinghouse. Let's create a website. Oh, we have a problem with suicides in our county. Wow, we need to do something about that. What is the core problem here? Everything has kind of been a strategic intervention based on kind of the emerging needs of what's happening in the community. Kim Henningsgaard learned about YSCREEN. She brought it to the St. Croix Falls School District as a pilot site, and we're like, yeah, let's do it. And what that did for us was it said, okay, we can screen all of our ninth graders and see how they're doing.
Assessing your mental health is normal and something that we should all be doing on a regular basis.
I can think of a girl who, as a freshman, she came in and the YSCREEN there was a red flag that popped up.
We wouldn't blame a child for having cancer, just like we shouldn't blame a child for having the signs and symptoms of depression or anxiety.
Her anxiety was at times out of control.
It's not something they're choosing. They're not wrong or bad.
She just needed tools on how to deal with it.
It's something that's happening to them, and there's treatment if people are open to it.
And by the end of last year, the end of her sophomore year, doing awesome. And she was found via the YSCREEN for sure.
Every student who participates, not just those students who are deemed at risk by the way they answer the questions, but every student comes in and meets with a mental health clinician.
In those 2 years, I bet we've had, if I were to quick guess, 15 students who have been introduced to a mental health therapist and who are getting help and who are benefiting from that arguably probably wouldn't have without the YSCREEN.
Keeping YSCREEN going and making it available to all the schools would be definitely something that would be great if there was no cost to the schools, because, you know, that's prevention. Healthy Beginnings was specifically designed to provide home visiting services for families that lacked access and resources or insurance. When typical development doesn't occur, it can kind of manifest itself in a variety of ways. It can be behavioral, it can be psychological, it can be emotional, it can be physical. And then you add trauma into that. This is young children. We have to do something earlier, and that's what's so beautiful about Healthy Beginnings, is that it's really geared towards 0 to 5-year-olds. And that's really where it's at.
There is so much more that the task force can do to increase the emotional well-being of Polk County residents.
I see a continuation of the suicide prevention, question, persuade, refer. I see us doing more work around ACEs, adverse childhood experiences.
The stigma around mental health issues is being reduced because of these opportunities.
We are an established nonprofit in the community with a strong reputation of providing really reputable programming.
I think our community has rallied around the task force and has been generous with us, but we always need to continue our programming and sustain our programming.
We're talking about relationships, we're talking about mental health, we're talking about human beings.
I mean, obviously there's a lot of people affected because we have such a good turnout 2 years in a row with not good weather. So Yeah, I think it affects way more people than we can even imagine.